What is an AED? An AED is a device to be used when someone is in cardiac arrest to potentially restore an abnormal heart rhythm. It is common just after someone goes into cardiac arrest for there still to be residual electrical activity present in their heart. If the AED identifies this residual electrical activity as what is defined as a shockable rhythm, it could potentially restore it to a perfusing rhythm through the use of defibrillation. What are the benefits of using an AED? The benefits of using an AED are twofold. Number one, from the time you turn the device on, it will give you detailed instructions to follow throughout the course of your resuscitation attempt. Number two, if the victim is in what's defined as a shockable rhythm, the use of defibrillation can increase their chances of survival by 10 to 15 times. What types of facilities are you likely to find an AED on site? Typically, you can find AEDs in government buildings such as courthouses or post offices, in educational facilities such as schools or daycares, in places with an increased risk of a cardiac event such as a medical office or a gym, in places that are hosting large amounts of people on a daily basis such as a big box store or a shopping mall, or even outdoor places such as a playground or a sports complex. When should you retrieve the AED? As soon as it is determined that the victim is unresponsive, immediately activate the emergency response system by dialing 911 on your mobile device and sending someone to retrieve the AED. If there are 2 or more rescuers on scene, one rescuer will leave to retrieve the AED while the other remains with the victim and continues their assessment. If it is determined that the victim is in cardiac arrest, immediately begin CPR. If you are by yourself and the cardiac arrest was witnessed, leave the side of the patient to retrieve the AED and return to the scene as quickly as possible. If you are by yourself and the cardiac arrest was unwitnessed, first perform 5 cycles of CPR before leaving the side of the victim to retrieve the AED and returning to the scene. How do you locate an AED? AEDs are typically located within 50 feet of the main entrance of the facility. Traditionally, they are mounted in a case on the wall similar to a fire extinguisher. You can also identify the AED by a sign with the letters AED and a heart with a lightning bolt insignia. If you are having difficulty locating the AED, ask facility personnel for assistance. Once you have located the AED case, remove the AED device along with all of the contents of the case and immediately return to the scene. Once the AED arrives on scene, the first step for usage is to turn the device on. Some devices will turn on automatically once you open the case. Most devices will require you to manually press the on button, which is usually located in the center of the device and easily identifiable. Once you turn the device on, you simply need to listen and follow the prompts. Once you manually power the device on, you will begin to receive audible prompts.
Adult patient. If the patient is a child, press the child button.
The first audible prompt that I received from the trainer device is it informing me that it is defaulted to adult mode. If you have a child victim, some devices do have the capability to be changed to child mode. Locate the child mode button, press it down, and activate child mode. Once in child mode, the device will lessen the energy that is delivered with the defibrillation based on the smaller size of the patient.
Remove clothing from the patient's chest.
The next audible prompt that I received from the device is informing me to remove the clothing from the patient's chest. Since the patient is unresponsive, this will require using a pair of trauma shears to cut through the clothing. Grab the trauma shears from the first responder kit, start at the collar of the top, and cut downwards through the bottom of the shirt. Pull the shirt open and expose the bare chest. Women generally wear bras underneath their shirts. Bras have wire in them and conduct electricity, which can be hazardous when we're using electrical therapy. Therefore, the bra will also need to be cut through to expose the bare chest completely. Once the patient's bare chest is exposed, you might find obstacles to successfully placing your pads. If the patient is wearing a necklace, pull the necklace around the back side of the neck and make sure that it is draped down over the back as opposed to draped down over the chest. If the patient has a pacemaker, which would be identified by a protrusion underneath the skin under either one of their collarbones, do not place the pads directly over the pacemaker. If the patient is wearing a medication patch, ensure that you have medical gloves donned and remove the medication patch. If the patient was submerged in water, pull the patient out of the water and towel them off to the point that you can get the pads to adhere to the skin. If the patient has an extremely hairy chest to the point where the pads will not adhere to the skin, use a disposable razor that is in the first responder kit to clean the areas needed to adhere the pads to the skin.
Remove packet and apply pads onto patient's bare skin.
The next audible prompt that I received from the device is to remove the packet and to apply the pads to the patient's bare skin. Once you remove the packet and you inspect the pads, you will see there is a diagram instructing you on where to successfully place the pads onto the patient. The correct pad placement for an adult patient would be one pad on the upper right side of the chest and one underneath the left breast. The reason that the pads are placed in this position for the adult patient is that the patient's heart sits just off center in the left side of the chest. When the heart is functioning normally, the SA node, located at the top of the right atrium, is sending an electrical impulse down through the atria and the ventricles, causing the heart to contract. When the pads are placed upper right and lower left, an electrical shock is being sent between the two pads and following the natural pathway of the electrical conductivity of the heart. The correct pad placement for a child patient is one pad directly in the center of the chest and one pad directly in between the shoulder blades on the patient's back. The reason that the pads are placed front and back on the child patient is that their torso is smaller. If the pads are close to touching each other, when a shock is sent in between the pads, it could potentially cause an electrical arc and be hazardous to the rescuer.
Remove packet and apply pads onto patient's bare skin. Apply pads as shown in the pictures. Press pads firmly on skin. Press pads firmly on skin. Do not touch the patient. Analyzing heart rhythm.
Once the pads are firmly adhered to the patient's bare skin, the device will give the prompt to stop touching the patient while it analyzes the heart rhythm. The device is not delivering a shock at this time. It is attempting to analyze a shockable rhythm. You have a pulse. If you are touching the patient while the device is attempting to analyze the heart rhythm, it will detect your pulse and give a false reading. Up until the point where the device prompts you to stop touching the patient, CPR should be in progress. It will take some time to remove the shirt, remove any obstacles from the chest, and to apply the pads. The goal is to minimize the interruptions in CPR to 10 seconds or less.
Do not touch the patient. Analyzing heart rhythm. Shock advised.
Once the device detects a shockable rhythm, it will begin to charge. Once the device is fully charged, the shock button will begin to flash red. It is imperative that prior to manually pushing the shock button, that you ensure that no one is touching the patient.
Do not touch the patient. Everyone clear. Press the flashing shock button. Shock delivered. Begin CPR.
Once the shock is delivered, the device will immediately prompt you to begin CPR.
10.
Some devices are equipped with a metronome to keep you on pace with your compressions.
20.
The device will begin to count your compressions for you.
30. Give 2 breaths.
After 30 compressions are complete, the device will prompt you to deliver 2 rescue breaths. After 5 cycles, the device will tell you to stop compressions while it analyzes the heart rhythm once again. After the device prompts you through 5 cycles of CPR, it will once again tell you to stop touching the patient while it analyzes the heart rhythm. If at this point it says no shock advised, check the patient for a pulse. If the patient does not have a pulse, resume CPR. If the patient does now have a pulse, you can stop CPR and continue to monitor the patient until first responders arrive on scene. This concludes our training on the Automated External Defibrillator. I commend you for taking proactive steps to ensure the health and safety of both you and your community. Please remember to like and subscribe for more free emergency training content delivered by an expert level instructor. Stay safe.